Assalamualaikum and good morning to Madam Nurunazia and our respective panelists. I'm Ayuna Sufina, your moderator for today. Our discussion for today will be about SDG 3. Each of our panelists will explain key topics related to SDG 3. For introduction, Sustainable Development Goal 3 or SDG 3 focuses on ensuring healthy lives and promoting well-being for people of all ages. Health is important because it affects not only individuals but also the overall development of society. SDG 3 also aims to reduce preventable death, control infectious disease, and address non-infectious disease such as heart disease, cancer, and diabetes. It also emphasizes mental health, road safety, and access to essential medicines and vaccines, and equal access to healthcare. In addition, SDG 3 highlights the importance of strong healthcare systems and a clean environment as factors like air and water pollution can impact public health. Overall, SDG 3 aims to improve both hope to live, and quality of life for everyone. So without wasting any time, so I'm sorry. So without wasting any time, let's start with panel one, who will explain about public awareness and health education.
Okay, good morning to Madam Nurunazia and good evening to our fellow candidates. I want to start with something we all can relate to. Why is it that many people only start caring about their health when something goes wrong? Even though clinics, hospitals, and health information are everywhere, health is still not the top priority for many people. From what I've seen, a lot of people, especially young adults, feel that health problems are something not to worry about. When they feel okay, they think, I'm fine, I don't need to check up. So habits like skipping meals, drinking a sugary drink, or not exercise are become normal, even though they slowly affect our health. One point from the article that really stood out to me is that many people are actually unaware of the behavior or action that will lead to increase their risk to get communicable disease such as diabetes or heart disease. This is interesting because health information is widely available, yet awareness at the individual level is still quite low. Another thing is how health information is shared. Sometimes it sounds too technical or too serious and people just switch off. When advice doesn't feel relevant to daily life, it's easy to ignore it. But when health messages are simple and relate, people are more likely to listen. For example, when community programs explain about health using everyday food or daily routines, it really helps people understand. Social media also plays a big role today, especially for younger people like us, because health message can be shared in a more casual, engaging way. And finally, to me, health education isn't about telling people what to do. It's about helping them understand why their choice is matter. When people realize that small daily habit can affect their future, they are likely to care about themselves. So that's all for me. Thank you.
Thank you, panel one, for sharing those insightful points with us. We should move on to panel two with topic about importance of early treatment and Prevention. Panel two, you can start.
Thank you to the moderator and good morning to the Madam Nurunazia and other panelists. So what a good point from panelist one. As one of the panelists today, I would like to talk about how important early treatment and prevention is, especially through early intervention in children, which is closely connected to SDG 3, good health and well-being. So one important issue highlighted in the article I referred to is early detection. In reality, this is where we often face challenges because many parents are not fully aware of the early signs of developmental delays. Some parents assume that their child will eventually catch up, while others may not realize that missing certain milestones can be an early warning sign. For me, early childhood is a very critical period at this stage because children's brains are still developing rapidly and are highly responsive to learn and to support. So when delays are identified early, the intervention can be provided at the right time. So which can help to prevent the bigger problems later on, such as learning difficulties or social and behavioral issue. The articles explain prevention in three simple levels. For the first one is primary prevention, which focus more on promoting health development and increasing awareness, especially among parents and caregivers. For the second one is secondary prevention, which involve early screening and early detection so that intervention can be gained as soon as possible. And for the last one is tertiary prevention, which it aims to reduce the long-term impact and improve quality of life for children who already have identified the challenges. So this shows that prevention is not just about a treatment. It is about awareness, early action, and continuous support from all around people. When parents are better informed about the early intervention and give fully support for their children, children are more likely to have to receive help early. At the end of the day, I think the idea of no one left behind means making sure that every child has access to early detection and early intervention, regardless of their background or level of parental awareness. So, to conclude, all my points is early treatment and prevention is very crucial so that we can together have stronger parental awareness to make sure all the children have a good health for their future and we can ensure health coverage for every stage of life and we can achieve the SDG 3. So that's all from me.
That was really interesting. Thank you, panel 2, for sharing your perspective with us. Let's move on to our next panel. Panel 3 will discuss a topic about healthcare from childhood to older age. Panel 3, you can start your sharing.
Okay, so everyone can hear my voice, right? So thank you to moderator for allowing me a chance to talk. So today I'm going to share with you the healthcare needs from childhood to older age. So first we need to understand what healthcare means. So healthcare is organized provision of medical services to maintain and improve people's health. So to put in simpler version, it is everything that doctor, nurse, hospital and clinic done to ensure people stay healthy and live a longer and better life. So as we see, every stages of life from childhood to older adults, the healthcare needs are vary for every age group. So it is important that healthcare needs are fulfilled to maintain the health situation. So based on the article I found written by Jia and Liu in 2024, the study is conducted to find co-occurrence of multiple health services throughout the life course of rural residents in China. So based on the studies, childhood is focusing on early prevention and intervention. So as the healthcare service, it is mainly focused on immunization, routine medical checkups for the baby, and also growth monitoring to avoid early signs of growth problems such as malnutrition, and or delayed development. So, as we shift to adulthood, healthcare is now focusing on maintaining health and prevent chronic disease. So, based on GIAM, adults require regular health screening, preventing services, and management of lifestyle-related risks such as poor diet, stress, and physical inactivity. So it is important as many of chronic disease such as cardiovascular and diabetes often develop around this age group. So, as we enter the older age, the healthcare needs become more complex and long term. So, based on the study, older people often suffer more than one health problem in the same time. So, as example, my own grandmother was diagnosed with diabetes and hypertension in one checkup. So older adults rely on chronic disease management, rehabilitation, exercise guidance, and daily function. So older people prefer using traditional Chinese method TCM such as acupuncture, cupping therapy, and herbal medicine. But they also combine those modern and traditional healthcare services as well. That's all from me.
Thank you, Panel 3, for your insightful explanation. Let's move on to our last panelist. Panel 4, you can start your topic about financial problems and medical costs.
Sorry everyone. It's logged out but accidentally. So thank you to moderator and assalamualaikum to Miss and all the panelists. The financial protection is important because sorry. Financial protection in healthcare is about making sure that people can access medical service without risking their financial stability. Medical expense can be unpredictable, and even small health problems can become expensive if it left untreated. And even small health problems can become expensive. For, for many families, the cost of treatment can affect not just their finance, but also their overall quality of life. Medical costs include more than just hospital bills and in surgeries. They can involve medication, regular checkups, therapy, and even transportation to healthcare facilities. For people with chronic conditions, these costs occur regularly, which can make long-term care very challenging without financial protection. One way for financial protection help is by reducing out-of-pocket expense. Insurance plans, government healthcare programs, or employer-provided health coverage can cover part of all these costs. This allows individuals to get the care they need promptly without having to choose between paying for treatment or covering other essentials. Financial protection also encourages people to plan for their health proactively. When people know that some of the cost is covered, they are more likely to attend regular checkups, get vaccinations, and monitor chronic disease. This can prevent complications, which are more expensive to treat and harder to manage if ignored. Beyond the individual level, financial protection contributes to the stability of society. Families are less likely to fall into debt or poverty due to medical bills.
Thank you, panel, for that was such a quite wise perspective. Thank you for sharing that. With the help of explanation from four of our panelists, I would assume many of us are able to foresee what SDG 3 is really about. But I still have a lot of questions to ask for better understanding. I think I will start with panel 3. Panel 3, I would like to ask, how do immunization and routine checkups contribute to long-term health?
Okay, so as I will start, so immunization protect individuals from serious infectious disease such as polio, measles, and rubella to reduce the risk of complication that can affect health in future. So as for routine checkup, it allows healthcare providers monitor growth, development, and overall health to prevent it from become severe. By taking this healthcare method, the risk of chronic disease is reduced. It could contribute to lower healthcare costs and support a better and quality of life. Okay, thank you.
That was such a detailed sharing. I think I got it now. Since now we're living in a modern world where almost everyone uses social media for various reasons, I would like to ask panel one, in your opinion, how can social media and digital platforms be better used to raise public awareness about health issues?
Thank you to moderator for the question. So in this era, seriously talk, social media is everything now. It's where we get news, memes, live updates from our family to communicate. So yeah, it makes a total sense to use it for stuff that matters, like health info. I think social media works best when health information is shared in a simple and engaging way, like through short video or real life example. It also need to come um, from trusted sources so people don't get confused by false information. Thank you.
Thank you, panel one. Thank you, panel two, for sharing your your perspective. Um, It got me thinking, since the world we live in now has such huge problems about inflation which affects our financial, I would like to ask panel 4, how does financial protection help with medical costs?
Thank you, moderator. Financial protection help with medical costs is it encourage people to seek medical care early, which help prevent serious health problems. In short, financial protection provide peace of mind and ensure everyone can get health care when they need it. That's all from me. Thank you.
Thank you, panel 4. Um, I heard a saying, an apple a day keeps the doctor away. That relates to panel two's topic. So panel two, may I ask, how does early detection and early treatment help improve a child's health and development in the long term?
Thank you to the moderator for the question. So, from my point of view, I think early detection can help to identify health or developmental problems at an early stage, which can allow the treatment and support to start as soon as possible. So, when children receive early treatment, it can prevent the condition from becoming more serious and reduce long term difficulties in learning, behavior, and social skills. This gives children a better chances to grow, develop, and normally and enjoy their healthy future. So that's all.
Thank you, panel two. What an interesting sharing we got today that really opened my eyes about what SDG 3 really is. Overall, SDG 3 focuses on ensuring that everyone at every stage of life has access to proper healthcare without being burdened by high medical costs. It emphasizes the importance of early treatment and prevention to reduce serious health problems in the future. At the same time, public awareness and health education play a key role in helping people understand their health their health needs and make better decisions. I think that's all for our sharing today. Thank you everyone for lending your ears.